With this, we move to a very important speaker from J&K to the eastern part of the country. Let's have a perspective from the beautiful state of Tripura and how healthcare transformation is taking place in the state of Tripura. We have with us Dr. Siddharth Shiv Jaiswal, IAS Mission Director, National Health Mission Department of Health and Family Welfare, Government of Tripura. We welcome Dr. Siddharth Singh Jaiswal. Let's hear him out. Let's hear his vision on digital strategies for transforming public health in India, technology governance and service delivery, especially giving a Tripura perspective. We welcome Dr. Siddharth Singh Jaiswal.
Respected dignitaries and dear colleagues, I am Dr. Siddharth Shiv Jaiswal, Mission Director, National Health Mission in Tripura. As we know, there has been an unprecedented advancement in the technology in the past 2 decades, and which had its impact across all the social sectors, among which health has been a major beneficiary of all the technological advancement. So I would just like to start with the initiatives which has been taken at the national level, which has been adopted by the state of Tripura. And since we are passing through a pandemic, I'll be talking initially about the role of technology and the technological advancement which helped us in fighting the pandemic. And later on, I'll be talking about the role of the technological advancement in non-COVID healthcare services. So, this technological advancements during the past a couple of decades has helped us now to tackle this pandemic in a better manner as compared to what the humankind suffered during the last century, like the Spanish flu and all. Today, we are in a better position to handle such pandemics. I would just like to cite few examples how we could achieve these things. First of all, the nature of the virus itself. The present status of technology helped us in the complete genome sequencing of the virus. So that is the beginning. That is the beginning of developing our diagnostic tests to detect the virus in various kind of samples in the body. And also it helped us a lot in discovering the right vaccine for the virus. So once we could achieve that genome sequencing, we could develop those tests, RT-PCR tests, which could give the results with very good sensitivity and specificity. We could develop that in a very short span of time as compared to the previous occasions. With the progress in the disease, it was felt that a certain kind of test is required with which we can have a massive screening in the community. So accordingly, this rapid antigen tests were discovered, which helped us a lot in testing the population as a whole in a very short span of time. While the RT-PCR used to take 3 to 4 hours, the rapid antigen test takes only 3 hours. Half an hour, 30 minutes. Similarly, some developments have taken place, and now certain tests are in trial which could detect the presence of virus with the use of saliva. Traditionally, we used to take sample from the nasopharynx. Not only that, even the medical equipments which were in use, for example, for diagnosis of tuberculosis, like the CBNAT and the TrueNAT machines, and the tests which we are using, which we have been using for diagnosis of tuberculosis. With this technological advancement, we could customize those the testing kits to diagnose the COVID-19. And since these machines were already available in many districts, we could decentralize our testing. So, if we compare with the situation in March 2020 to the present situation, we could expand our laboratory services exponentially in a very short span of time. Um, Similarly, we could use the technology in tracking. We developed many kind of apps like the RL, the Setu and all. We had a specimen referral form which we filled with each sample, which helped us in tracking the contacts of the positive person, which went a long way in containing the disease. Then, not to mention about the treatment part, um, we we could we could develop uh, the drugs for treatment in a very short span of time, like the remdesivir, tocilizumab. Then the ventilators played an important role in recovery of the critical patients. I know a case. My friend from college, he could retrieve a patient after 56 days of uh, ventilation. That's an incredible feat, which can be and which can be made possible only because of the level of technology which we are using, the level of supporting drugs and the equipments which we are using. Then also we saw that the artificial intelligence and the various kind of softwares were put to use to monitor the logistics at various levels nationally. What I mean to say, the presence of the critical equipment in a health sub-center could be monitored by a person sitting in Delhi with the press of a button. So this is really remarkable because um, till now we could monitor only the dispatch of the items to the state level and mostly to the district level. But now, with the level of portals in use, with the level of tools in use, um, uh, a person sitting in the government of India can find out the availability of logistics, like the equipments, the testing kits, the ventilators, ICU beds, everything in a remote corner of the country. Like we have remote places in Tripura, but still sitting here, I can monitor the availability of different kind of logistics in that particular place. Similarly, the disease prediction uh, helped us a lot in preparing for this pandemic. Um, Even now, there are certain predictions made for the third wave. This we are able to make it because of the rapid development in the technology. Then I would like to mention about the vaccines. I think this is the shortest span of time in which we could develop the vaccine. The disease got originated. Uh, we could find the first case of the disease in November or December month of the year 2019, and then we could develop the vaccine and launch it in the public domain. I'm talking about India in the month of January itself. 16th January, the vaccine was launched in India. So within a span of 1 year, the complete uh, development and various kind of trials for the side effects, its effectiveness could be done, and the vaccine could be launched in a span of 13, 14 months uh, after the detection of the first case, which is quite remarkable. And now we see that there are around 22 vaccines across the globe uh, which have got emergency use authorization. Similarly, there are 7 vaccines in India, out of which the Covaxin has been totally uh, developed indigenously. So these kind of developments have really played an important role in uh, improving the life expectancy of people and saving the humankind, if I can say in one word. Then we use the platform Coven. We could track like each and every individual with the help of this portal Coven, which was used across the country. Uh, so now, the state of Tripura, we could immunize around 94% of the total population more than 18 years with the first dose as of now, uh, and around 37% with the second dose. So, with the use of technology, what I mean to say, with the by utilizing this COVID portal, I can find out the list of all the persons for whom the second dose is due. Now, I can contact them. I can pursue them to come to the nearest vaccination center for vaccination. I can have my team reaching to their individual households just to ensure that 100% of the people, 100% of the population is vaccinated, and there is a kind of herd immunity to the extent that immunity is achieved at a critical level beyond which there is no transmission of the virus. So all these, I'm talking about the steps we had taken to control this pandemic, in which technology played a major role. Uh, Now I will be talking about the non-COVID health services, which are in use in Tripura, through which we have been improving the health indicators a lot. Recently, I'm talking about the latest developments in the state. We have launched the mother and child tracking system. We have a platform available from the government of India by the name Anmol, that means ANM Online. With that, like I spoke about COVID, the same concept goes behind the mother and child tracking system. Uh, we can we can track each and every pregnant mother and child for various kind of routine checkups, for arranging for her institutional delivery and after delivery for the vaccination of the child. We have distributed these tablets with the software, Anmol software, to our ANM workers who are going house to house. Then they are registering the eligible couples. Eligible couples means those people who are married and are in the reproductive age group. The women are the potential um, uh, uh, pregnant cases. So right from the eligible couple time, we are tracking them. Then once they become pregnant, we are ensuring that the right kind of tests are done at right time. The required supplements are given to them in the form of iron and folic acid tablets. Then the tetanus TT is given to them. Then when the time for delivery comes, we arrange for their transportation. If the location is quite remote, we arrange for their transportation to the nearest institution and arrange for the safe delivery in an institution. And after the delivery we would ensure that 100% of the child uh, is vaccinated with the vaccine preventable diseases. So this is going to be a landmark step as far as the improvement of maternal and child health is concerned, and the state is going to see the benefits of this initiative in the times to come. I'm sure there is going to be a drastic reduction in the maternal mortality rate and the five mortality rate and infant mortality rate. This is one of the initiatives which we have adopted in the state. Then we have also distributed smartphones to our ASHA workers, and also smartphone to our Anganwadi workers. We are having around 9,911 Anganwadi workers in our state, and each one of them is having a smartphone. So whatever document they were maintaining in the physical format, they are now entering the data in a real-time basis into the mobile, and that data is available with me uh, uh, at all times, basically. So the Anganwadi workers are using the portion tracker, in which they are entering the weight and the other development parameters of the child, and the application itself tells the Anganwadi worker that whether the child is having normal nutrition or is having moderate malnutrition or severe malnutrition. So such kind of advancements will go a long way in improving the nutrition figures. Similarly, the smartphones given to the ASHA, they are also making necessary entry as far as the non-communicable diseases are concerned. Uh, so the best part of this technology is, first of all, the data is readily available at one platform, rather than having 10,000 registers at 10,000 places, and retrieving a data from of a particular person from a particular register. The is the hard work involved is beyond imagination. Now the same data can be retrieved at all corners of the country. Um, so the first advantage was the ease in the accessibility of the data. The second advantage is the ease of entering the data. Had there not been a smartphone, the same data uh, would have been entered into a register which is heavy to carry because it's a big register with plenty of pages. So the worker would insist that the beneficiary should come to the Anganwadi center or the health sub center, but with a smartphone in hand, they can go house to house, enter the data in a real time basis with better accuracy. So these are some of the advantages. Then tracking them in the sense that as soon as the child or a mother uh, uh, is due for vaccination, the application flags those cases, which comes to the notice of our field worker, um, which was not possible with the data being maintained in the offline manner. So similarly, the same information, like for the persons for whom the vaccines are due, can be known to me, and I can monitor the performance of our field workers as sitting here in my office. So the advantages are uh, many. Similarly, we have started with the tele-ophthalmology project. We have got around 44 vision centers across the state. Any person going to any vision center, those vision centers are acting as a spokes, whereas the hub is in our state hospital. So the technician there examines the patient and seeks clarification from the specialist who is sitting at this spoke. And if any kind of referral is required, that is coordinated, and the person ensures and the technician ensures that the patient comes to the state hospital for necessary treatment, like the surgery for cataract, then correction of the vision. These are some of the common diseases for which the teleophthalmology is being used. Then the teleradiology, because the availability of trained manpower uh, is a challenge in the state. So we take digital X-ray, and through tele radiology we send it to the agency located in Bangalore. The radiologist there studies the X-ray, reports back to us in a very short span of time. So similarly, we are having the telemedicine, where the spoke is at the state hospital. The hub is at the state hospital. Spokes are all the sub-centers, 1,000 sub-centers connected to a hub. And we are not limited with the availability of manpower in our state, meaning to say that a person sitting anywhere in the country, knowing the local language, which is Bangla in the state of Tripura, can suggest treatment, can suggest prescription for the people here. So definitely these technological advancement have played a big role in containment of this virus, and also improvement of the health indicators uh, in the world. And the COVID has given more has expedited the adoption of the technology by the healthcare facility. I mean to say, even the health facilities would be benefiting because the government is paying more and more emphasis, paying dedicated funds for adoption of telemedicine and HMIs, that is human management, health management information system. So the coming times are going to be very interesting as we see how these technological advancements unfold in delivering better services to the mankind. Thank you.
Thank you, Dr. Siddharth Singh Jaiswal, IAS Mission Director, National Health Mission, Government of Tripura. He spoke at length of various initiatives being undertaken in the state of Tripura and how technology innovation is being leveraged there. If I just take a crux of what he has said and just give two small examples, he spoke about both the COVID situation and non-COVID activities, how technology being leveraged in the state. He spoke about how they're using technology through the COVID app to ensure that no one is left there to not to be vaccinated. Almost, I think, more than 90% have been vaccinated first dose in Tripura, and almost 35-36% have been vaccinated of second dose in Tripura. And they're monitoring that. They're keeping a track on that through the COVID app for the successful vaccination program. And also, he gave an example of non-COVID activity and how technology is being leveraged. There he gave an example of mother and child tracking system, especially for pregnant women, and they're using an app developed by the government of India and how they're tracking the pregnant women so that their regular attendance can be done on them. Thank you, Dr. Siddharth Singh Jaiswal.